Good afternoon, everyone, and welcome to this New York State Health Foundation Conversations with event. My name is Bronwyn Starr, and I oversee our Healthy Food, Healthy Lives priority area. I want to welcome our panelists today. From the advocacy group Hunger Solutions New York, Sherry Tomasky, Communications and Public Affairs Director, and Krista Hesdorfer, the Child Nutrition Program Specialist, and also New York State Health Foundation's own Policy and Research Associate, Sophie Wheelock. A recent report from New York State Health Foundation examined food scarcity rates in New York State by race, ethnicity, age, household income, among other things, from the start of the pandemic through the end of 2020, using weekly self-reported data from the US Census Pulse Survey. So today the panelists are going to talk about the report's findings and provide some recommendations on how state and federal programs can improve food insecurity programming in New York State and also prioritize funding and outreach to food insecure populations. So then we'll have a discussion and there will be time for Q&A at the end of the presentation. A couple of housekeeping items. Today's event is being recorded and a recap of the slides and the recording will be sent out after the webinar. Also for the attendees, your video and audio are disabled. So any questions you have, we will invite you to share through the chat box towards the end of the discussion. So with that, I'm going to turn it over to Sophie, who is going to present the data today.
Thanks so much, Bronwyn. I'm very excited to have the opportunity today to share some of the findings from our recently released report, which, as Bronwyn mentioned, looks at food scarcity over the course of the pandemic among New Yorkers. So I'm just going to pull up some of that data. Now, before I actually present some of the findings from the report itself, I want to take a step back and talk a little bit more broadly about food hardship and how we measure food hardship, which measures we use and what type of data sources we have. When we talk about food hardship, there are a lot of different definitions and vocabularies that we use, like food insecurity, food insufficiency, and food scarcity. And each of these definitions can mean something slightly different, which can make it hard to make comparisons when we're trying to look at pre-pandemic periods and during pandemic periods. It's natural when I start to go through some of the findings from our research to want to have a number to compare to from before the pandemic to really be able to measure how much things have changed. But there are some important caveats I want to go over to make sure that we keep these in mind when we analyze the data. A very commonly used gold standard measure for food hardship is the food scarcity supplement, which comes from the Current Population Survey, which is administered by the Census Bureau and Bureau of Labor Statistics. And this measure measures food insecurity, which is a measure of both the quantity of food that people are eating, if they have enough food, as well as the quality of food, whether people have enough of the kinds of food that they want. So this is a relatively broad measure of food hardship and people's behavior while eating. The food scarcity supplement also asks about the last 12 months of people's experiences, which captures quite a long data range to be able to collect this information. So just as a benchmark, from 2016 to 2018, the food scarcity supplement found that 10.5% of households in New York State experienced food insecurity in the last year. Now, in comparison, the Household Pulse Survey is what we've used in this analysis. The Household Pulse Survey is a new data analysis tool that was created by the Census Bureau at the start of the pandemic in partnership with other federal agencies. And it captures information about food hardship, but also all kinds of measures to better understand how households are dealing with the COVID-19 pandemic, including mental health measures, whether people have delayed medical care. And the survey has been able to add more questions over the course of the pandemic, like people's attitudes towards the COVID-19 vaccine. In terms of food hardship, the Household Pulse Survey measures what's called food insufficiency, also called food scarcity. And this just measures the quantity of food that people have access to, whether they're sometimes or often not eating enough. So this is a more severe measure of food hardship than what we see measured in the food scarcity supplement. In addition, this data is only referring to the last 7 days of someone experience. So it's a much narrower window for people to have experienced food scarcity than the food scarcity supplement. So I really want to drive these differences home because as we look at the Household Pulse Survey findings, I want us to keep in mind that this is capturing data about a more severe form of food hardship because it's been measured in a narrower window and it's asking strictly about the quantity of food that people are eating. So with those caveats being kept in mind, I'll go ahead and present some of our findings. So let's first look at food scarcity overall, which is this graph on the left. This looks at the percentage of adults in households where there was either sometimes or often not enough to eat in the last 7 days across New York State. So again, this is just the quantity of food that people are eating. This doesn't take into account whether they're eating the types of food that they would like. And we see that in May, around when the survey started, that the food scarcity rate was about 10.5%. And over the course of 2020, this rate has steadily crept up. In December, it reached a rate of 14.3%. And again, if the household pulse survey asked about the last year of people's experience, and if it asked a broader measure of food hardship, it's likely that we would see these rates be even higher. What's extremely troubling is looking at the disparities by race and ethnicity with this data. We saw in December that nearly 1 in 3 Hispanic New Yorkers and over 1 in 5 Black New Yorkers experienced food scarcity in the last week. These rates are about 2 to 3.5 times the rate among white New Yorkers. We saw in December that Asian New Yorkers had a lower rate of about 3.2%. Also looking by income, we see wide disparities, whereby the lower a household's annual income, the higher their likelihood of experiencing food scarcity. Finally, we wanted to compare New York State to other neighboring states as well as the nation as a whole. New York is the black line here on top, and we see that compared to neighboring states, for nearly every month, New York had the highest rate of food scarcity. Compared to the US, which is the red line below, we see that New York and the US had about the same rate of food scarcity in May of 2020, but New York's rate crept up ahead and ended higher than the national rate. We also took a look at child food scarcity measured by the Household Pulse survey. And we saw that from June to December, about 1 in 5 households with children reported that the children themselves in the household weren't eating enough in the last 7 days because the household couldn't afford enough food. This is extremely troubling. We typically see among food scarce households that the eating behavior of adults tends to change first as food is reallocated and trade-offs are made so that way children can continue to eat normally. The fact that we're seeing such a high rate of child food scarcity shows really the extent of the problem where food scarcity itself is really reaching children within households. We also see extremely high disparities by race and ethnicity with child food scarcity and by income. We then used the Pulse survey to look at the relationship between household employment income loss and food scarcity. Logically, it makes sense to us that when somebody loses household income, that food scarcity risk increases. In December, we see that among New Yorkers who didn't lose household income over the course of the pandemic, that start date being March of 2020, the food scarcity rate was about 6%. But when the same question was asked among New Yorkers who had lost household employment income over the course of the pandemic, that rate was about 23%, which is almost 4 times higher. When looking at by different demographic groups, we see some really interesting patterns. Losing household employment income appears to have had the largest effect on food scarcity among Black New Yorkers. This black bar here is the food scarcity rate among Black New Yorkers who lost household employment income. And the green bar is the food scarcity rate among Black New Yorkers who did not lose household employment income. In December, Black New Yorkers who lost household employment income during the pandemic had food scarcity rates nearly 9 times higher than their counterparts who hadn't lost household employment income. This may be due to not having the same safety net or savings built up as other New Yorkers to be able to withstand the impacts of having lost household employment income, or could be due to multiple members of a household losing household employment income at the same time. The Pulse survey also asks people about their use of free meals and groceries over the course of the pandemic. We saw from May to December that about 10% of New Yorkers reported that they had accessed free meals or groceries in the last 7 days. The poll survey also asked among those
data again. Thanks for your patience. So the poll survey asked among those who had lost household, or I'm sorry, it asked among those who had accessed free meals and groceries in the prior week, which points of access they had used to actually access those free meals and groceries. Respondents could select multiple locations, so these categories aren't exclusive. We saw that in May, about half of people who had accessed free meals or groceries responded that they had used a school-based program. This rate decreased rapidly over the course of the summer, reaching a low point in September. And this might have been influenced due to a reduction of school-based grab-and-go meal locations over the course of the summer. The rate rebounded in October, which also might have been influenced by the reopening of New York City public schools, where children were able to access grab-and-go meals within the cafeterias themselves. What's interesting is that we see, in response to this decline in school-based meal programs, we see a subsequent increase in use of pantries, in reliance upon family, friends, and neighbors, and religious institutions. I also want to point out that the use of shelters might be artificially low in the data that we're sharing. Because the pulse survey was administered online, populations that rely on shelters for free meal and groceries might have been less likely to have been captured in the survey sample. Finally, the pulse survey asked people about their household spending sources, which sources of income people use to meet their weekly household spending needs. And we looked at the question among food-scarce New Yorkers and among food-sufficient New Yorkers. This black bar is among food-scarce New Yorkers. And we see that over half of food-scarce New Yorkers reported that they had borrowed money from friends or family in the prior 7 days in order to meet their household spending needs. The next most commonly reported use was credit cards or loans and money from savings or selling assets. It's really concerning that the 3 most commonly reported ways of meeting household spending needs are these non-sustainable methods for obtaining money that might set households up for more financial trouble and exacerbate food scarcity in the future. When we compare this to food-sufficient households, we see that the most commonly reported method was regular income sources like those received before the pandemic. So again, this really underscores the relationship between household employment income loss and food scarcity, whereby food-sufficient people were much more likely to have retained their income from before the pandemic, as opposed to food-scarce people who are more likely to have lost household employment income. So before I pass things off to Sherry and Krista, I just want to go back to our very first cut of data and just emphasize how troubling it is that we see this steady increase in food scarcity from May to December over the course of the pandemic in New York State. Again, this is a very severe measure of food scarcity where the quantity of people's food is decreasing. In addition, the rate of child food scarcity is extremely high, which is showing the extent of the problem. And the disparities by race and ethnicity are particularly troubling. So towards the end of our conversation, I'm happy to take any specific questions related to the data itself. And also our recap that will be sent out after the presentation will also include our full report, which includes some additional questions from the pulse survey and some additional cuts of data. Thanks.
Unmute. Thank you, Sophie. Now that we have a better sense of, not surprising sense, but more in-depth sense of who's more vulnerable to food insecurity, how they're dealing with it, yes, we're going to ask Hunger Solutions to talk a little bit more about the broader implications, the rescue, recovery bills, what they've accomplished, what they may accomplish. And yes, again, we're going to share slides at the end of this for those who just joined. But first, please, Sherry, if you could describe a little bit about Hunger Solutions New York and the work you guys do, that would be really helpful.
Thank you very much. We're very honored to be joining the New York State Health Foundation on today's program. Krista and I are with Hunger Solutions New York, and we are a statewide anti-hunger organization, and our mission is to maximize participation in federal nutrition assistance programs. So we focus primarily on SNAP, WIC, school meals, summer meals, and after school meals, and most recently, the pandemic EBT program, which is really our newest federal nutrition program. And we do much of our work through a program that we operate called the Nutrition Outreach and Education Program. And that is a program that funds organizations throughout the state to conduct SNAP outreach and application assistance at the county level. And that program also helps connect New Yorkers with other nutrition assistance programs as well. But we also have the ability at the statewide level to monitor both state and federal policy around nutrition assistance and to do statewide outreach and education, and when necessary, technical assistance around the suite of federal nutrition programs. So we are glad to be here today, and we have sort of our perspective on the federal and state response to the pandemic and how that has addressed food insecurity. So with that, Bronwyn, I'll go ahead and we'll do our slides. Thank you. We thought that we would begin our portion of the presentation just to do a quick recap of the federal and state response to the crisis that Sophie so articulately demonstrated for you and how this is impacting New Yorkers. You may remember over a year ago when the pandemic first hit New York State with intensity, Congress responded with what was then the very first Coronavirus Response Act, which was called Families First. And this was enacted on March 18th, and this was the first of what you'll see to be 8 efforts of the federal government to respond to the pandemic. And these slides will go through just the nutrition assistance provisions of those pieces of legislation. So to address the pandemic, first and foremost, Congress did focus on the SNAP program. And that is appropriate because SNAP is our nation's first line of defense against hunger, and it is the largest anti-hunger program in the nation and in New York State. And so Congress took the opportunity to, first of all, suspend the 3-month time limit for able-bodied adults without dependents, which is a population of people who were limited to SNAP for only 3 months out of 3 years, unless they met specific work requirements. And so those barriers were removed and allowed that particularly vulnerable population access to the SNAP program immediately. And very significantly, Congress established SNAP emergency allotments, which took households that were not currently receiving their SNAP maximum and brought them up to the SNAP maximum for their household size. And Congress also allowed for a number of state waivers for SNAP flexibilities in their operations, and we'll go through what those are in New York State in a moment. This legislation also established pandemic EBT, which is a program that provided food dollars on debit cards to families of children who were receiving free and reduced price meals at school and lost direct access to those meals as a result of school closures. And while many families were able to continue to get grab-and-go meals at schools, this benefit was put in place for all of those families to provide extra resources to nourish those children during school closures. USDA also authorized a number of waivers and flexibilities to child nutrition programs, including school meal programs, which essentially allowed schools to provide meals to any child, regardless of income, for the duration of the school year. There was emergency funding to WIC, as well as a move to remote visits for that program, which really did help maintain and retain the participation in the WIC program for at least the early part of the pandemic. And then we also saw investments into both senior nutrition programs and the Emergency Food Assistance Program, or TFAP, which funds our network of food banks in New York and across the country. Congress then, several weeks later, in the end of March 27th to be precise, passed the CARES Act. And the CARES Act provided funding for the continued operation of SNAP and child nutrition programs to account for the increased caseload and the emergency benefits that we described in Families First, but it did not provide new funding or new expansions of the programs in this piece of legislation. It also provided additional funds for senior nutrition, home delivered meals, as well as the network of food banks, because by this point in March, I think the crushing demand on our emergency food system was very clear. The CARES Act was also where stimulus funds and pandemic unemployment benefits were enacted as well. And while stimulus funds were exempt from SNAP income, the pandemic unemployment benefit that was passed from the CARES Act, the $600 a week federal unemployment benefit, was not exempt from SNAP income tests. And for that reason, many households who received unemployment, including the federal benefit, were not eligible for SNAP. And so many households that may have already been receiving it with a low income that they lost and then got on unemployment may have lost SNAP benefits, but many more households that lost income and received unemployment benefits became ineligible for the SNAP program. So it's important to remember that SNAP was unable to serve most families on unemployment during this time because those benefits did put them over income, and it was reportable income for the purpose of this program. So we move now to the summer of 2020 and actually a long period of inaction by Congress. On July 27th, Congress passed the HEALS Act, which included no new funding or expansion of nutrition programs at all. There were other expansions of unemployment or continuation of unemployment benefits in the HEALS Act, but it did not directly impact nutrition programs. The HEROES Act, which there was a lot of talk about from May to October, actually never passed Congress or was enacted into law, but there were provisions of that legislation that we did see come to light in other relief packages later in the year. But none of these pieces of legislation had any direct impact on the operation or the expansion of nutrition assistance programs. It wasn't until October that Congress passed the continuing resolution for the federal budget when we actually saw additional expansion and extension of nutrition program provisions. So at this point, many of the waivers and flexibilities that were passed earlier in the year were set to expire, and this Continuing Appropriations Act extended many of the SNAP and child nutrition waivers that were expiring on October 1st. And again, it really came down to the wire on being able to extend the operation of these programs. The Continuing Appropriations Act also extended PEBT into the current school year that we're in now, and it also included a population of younger children who are in child care programs in addition to serving school-age children as well. There was also provisions to set up summer EBT projects across the country in this legislation, which we have yet to see come to life, but those are in the process of being developed right now for the summer that will begin in a few months. And then at the end of December 29th to be precise, Congress passed a Consolidated Appropriations Act, which also included several provisions to address the ongoing food insecurity crisis. For the first time since March, this nation had been screaming for an increase in the SNAP benefit for those who rely on the program, and Congress finally responded with a 15% increase in the value of the SNAP benefit, which would last for the duration of 6 months, January through June. That provided on average about $30 more benefit for those who were using the program. This legislation also made some expansions to access to SNAP for college students. And some of the rules around SNAP for college students can be complicated, but the short answer is that they actually face a lot of barriers in being able to receive SNAP with both work requirements and with other limitations to their access. So this definitely opens up some options for people in college who are struggling with food insecurity to receive SNAP benefits. And there was also a small investment to expand SNAP and its use online, which certainly became visibly obvious during the pandemic that it desperately needs expansion and attention. In the child nutrition programs, there were some fixes made to the PEBT expansion, as well as some emergency funding for school and childcare meal programs. And the emergency funding for the meal programs has proven to be extremely important to school districts whose meal programs are really operating at a significant deficit right now and in very dire straits due to low participation. And so this funding really has helped to recover some of those losses. There was also some investments in WIC looking at some new technology and explorations there, in addition to more funding for both senior programs and TFAP and the state's network of food banks. Now, in January, the president signed an executive order that also addressed some nutrition assistance provisions, including tasking the USDA with reviewing two provisions. The first is the Thrifty Food Plan formula, which is the formula that's used to determine the amount of benefit that a household receives each month. And for many years, advocates have been calling on the federal government to make the formula a little bit better and to provide more benefit to account for the higher cost of food over the past few years. And so the Biden administration has finally charged USDA with making an assertive attempt to review that formula with the goal towards increasing it to what's called the low cost food plan, which would provide about a 15 to 20% more benefit to households on SNAP. This executive order also charged USDA with looking at those emergency allotments that we talked about from the very first relief package, and looking at whether households that were already getting the SNAP maximum, which are the lowest income houses in our country, whether or not they are also entitled to an emergency allotment. Because as I said earlier, if a household was already getting a SNAP maximum, they were not eligible for any additional benefit before that boost came around in January. And so this charges USDA with looking at whether or not there is the possibility of providing those lowest income households with more SNAP benefit. There was also in this executive order a proactive increase to the value of the PEBT benefit, which had been earlier renewed for this current school year, and that increases the benefit by about 15% in the next round of benefits that will be issued, which we'll talk about in just a moment. And so finally, the most recent effort by our federal government to address the food insecurity crisis was the American Rescue Plan Act, which was just enacted a few weeks ago, earlier in March. This legislation extends the SNAP boost through the end of September, adding 3 more months to the value of that program for SNAP households. And it also invested more money into bringing SNAP online to more people in this country, which we desperately need the ability to do during a pandemic. The child nutrition programs, we saw some attention paid to. This took the PEBT program that was scheduled to end at the end of this current school year and extended it through summer of 2021. And it also allows for the implementation of PEBT during a school year or a summer when there are public health emergencies like COVID-19, so that a program like this can be operational very quickly and provide replacement funds for families, for children who cannot access school meals during the school day. This legislation provided a tremendous investment into the WIC program with a direct benefit to families with an additional $35 a month for fresh produce. And we're seeing that begun to be implemented as we speak. An additional $750 million for senior nutrition programs. And it's also very important to point out that this legislation finally included the long elusive state and local relief funds, which are not directly tied to nutrition programs, but I think most service providers would agree that state and local relief funds are going to help their programs remain viable at the local level. And those funds will allow the state and local programs to continue to provide services that are very needed in their communities. This legislation also increased and expanded the child tax credit. It provided new stimulus funds for individuals, and it extended unemployment benefits as well. Those extended unemployment benefits are not counted for SNAP income purposes going forward. So that actually is helpful for people who rely on the program and may have been ineligible otherwise. But all of those other federal supports are incredibly important in providing the safety net that families need to keep themselves out of poverty and to protect them from future food insecurity crisis that families are facing. So I think if you look at the history of what Congress has done, I think that what this has proven is that Congress did act quickly. There has been attention paid to addressing the food insecurity crisis. I think many people would say that it still has not been enough, and I think the data prove that. But I think it's also fair to say that these efforts have perhaps staved off a worse crisis that we may not even know we prevented. But I think when we compare what we know about the current food insecurity crisis to that of the 2008 and 9 recession, we have not seen food insecurity rates rise as high as they did during that time. And the quick action by our federal government probably has something to do with that. So we will continue to focus on what some of these federal policies should be going forward a little bit later in our presentation. I'd like to turn to the state actions that have played a key role in responding to the pandemic at the state level. Most of the policy that has addressed food insecurity has been done at the federal level, and rightly so, since the programs that we're talking about today are funded and regulated at the federal level, and a lot of that funding was critical for New York and other states to respond. But New York did step out with its establishment of the Nourish New York program. Many of you may be familiar with this, but if not, this is a program that provided state funds to agricultural providers, farmers across the state to provide their surplus products to food banks and connect the dots from farmer to food bank to family so that those products did not go to waste and they got into the hands of people who needed them the most. That program has been funded $35 million to date, and it is proposed to be made permanent in the state budget. And we strongly advocate that that be made permanent going forward, because Nourish New York really has set New York apart in terms of its response to addressing this part of the food insecurity crisis. And I think most agencies and organizations involved would agree that it has been remarkably successful. The pandemic EBT program is another example of success in New York State. That federal program allowed New York to distribute nearly $1 billion in food benefits to 2.4 million children in the first round of benefit distribution. The second round of benefit distribution is scheduled to take place this spring, and it will provide benefits to eligible children for the school year 2021. So retroactive back to September for children who are eligible, and through the end of the current school year, those who have been learning remotely and are eligible for free and reduced price meals will get a PEBT benefit for the time that they have been out of school. We don't know exactly when those benefits will be issued, but it will be sometime this spring, and it is expected to serve at least as many children, perhaps more, with a benefit of at least $1.5 billion to households in New York State. And I also just want to point out, even though the federal action has allowed our SNAP program to be very responsive, the amount of growth in New York State's SNAP program can't be underestimated. We've seen enrollment up about 5% statewide since the pandemic began, which may not sound like a lot. We think that New York did a very good job of providing benefits to those who were eligible before the pandemic began. So we didn't have as much of a gap to make up as perhaps other states did. but we're also seeing benefits up by about 30% over this time last year across the state, which accounts for higher enrollment, but accounts for the increased benefits that households are getting through the emergency allotment. So the SNAP program is pumping a lot of money into the hands of households who need it, which is being used up very quickly at the local level through being spent at food retailers. And so SNAP definitely needs to continue to be looked at as one of our state's primary responses to the food insecurity crisis. So with that, I'm going to turn the microphone over to my colleague, Krista, who's going to talk a little bit more about state waivers and also looking ahead at the kinds of policies that we'd like to see extended.
Thanks so much, Sherry. And thank you to the New York State Health Foundation for the opportunity to speak with you all today. So as Sherry mentioned, around this time last year, Congress granted USDA authority to issue nationwide waivers for child nutrition programs. And New York adopted a long list of flexibilities that were critical for adapting the nutrition programs and allowing them to continue providing services in a safe way. I'm going to spare you a complete list of the waivers, but I will share a few highlights just to give you a sense of what they allowed the programs to do. Perhaps most widely known, and as Sherry mentioned earlier, the waivers have allowed schools to serve free meals for all kids this school year. They've been able to do that by using the summer meal programs during the school year, which provides more flexibility and a broader reach than the usual school meal programs. As Sophie mentioned, the school meal programs have been an absolutely critical support and are some of the most used food access points during the pandemic. Several key waivers contributed to those free school meal programs, and I'm very happy to report that those have been extended through September. So we're going to continue to have these flexibilities in the summer ahead. One of the most notable flexibilities is the waiver to area eligibility requirements. Normally, these types of meal sites can only operate in areas where 50% or more of kids qualify for free or reduced price school meals. Now, during this school year and through the summer ahead, meal sites can operate in all areas of the state. Other waivers allowed for meals to be distributed grab and go or even home delivered in some cases, which made them much more accessible than the usual requirement that kids eat together at a group meal site. And for WIC, as some of you may know, participants typically need to visit a clinic for their appointments and to receive their benefits. New York adopted waivers that allowed clinics to serve participants remotely over the phone or through video calls and to issue benefits remotely as well. There were also several waivers implemented for SNAP. And again, I'm not going to attempt a comprehensive list, but I wanted to mention that there is a statewide waiver of those 3 months time limits that Sherry mentioned for able-bodied adults without dependents on top of that temporary suspension. There are also several additional waivers that local SNAP agencies could choose to implement. So keep in mind that these waivers may vary by county, but those local agencies could opt for flexibility in interviews for some SNAP applications and recertifications. They could expedite application processing, and they could extend certification periods for SNAP in certain cases. And I've linked here our COVID-19 page if that quick overview left you wanting more information about the federal waivers and how they were implemented in New York. We've been doing a comprehensive tracking of the waivers since the start of the pandemic on that page. So looking ahead, as we've discussed, COVID-19 has underscored the importance of the federal nutrition programs and the need to make permanent some of the changes that have allowed them to be so responsive during the crisis. We know that there's a long recovery ahead of us, and for low-income families especially. There are ways that we can strengthen the safety net programs, reduce pressure on the emergency feeding system, and ensure that New Yorkers have the help that they need, not just during this immediate crisis, but in the years ahead as we recover. First and foremost, we want SNAP benefits increased permanently. As Sherry mentioned, USDA is currently reviewing the formula that's used to determine those benefit amounts. It is high time that we move away from the outdated and insufficient thrifty food plan to provide a permanent boost in SNAP benefit amounts. We also need expanded eligibility for SNAP. As we saw in Sophie's overview, even though SNAP provided vital support for many families, there are a lot more families it could be reaching as a sustainable source of food access. We should expand eligibility and make it easier for people to receive and maintain their SNAP benefits. We also need to stabilize the school meal and childcare meal programs that have provided such valuable services during the pandemic, but have struggled with low participation, as Sherry mentioned earlier. Congress did establish that emergency cost reimbursement program to cover some of the months in 2020 when programs and schools were closed or operating at reduced capacity. But we really need that type of reimbursement funding to be extended through the entire public health emergency to stabilize those valuable programs. And of course, we don't just want to stabilize, we want to build and strengthen. And we have a really exciting opportunity coming up in child nutrition reauthorization. Every 5 years, essentially, Congress opens the books on the child nutrition programs, which is our key opportunity to advocate for big legislative improvements. It's actually been 11 years since the Healthy Hunger-Free Kids Act in 2010, if anyone's familiar. That was our last child nutrition reauthorization, but the next one is right around the bend. There's actually a Senate hearing tomorrow morning on child nutrition reauthorization. We are dreaming big for this CNR bill. To give you just a few highlights, we're really committed to free school meals for all kids as an essential academic support. There are a lot of steps we can take to get there, from an expansion of the community eligibility provision that allows high poverty schools to serve free meals, to improvements in direct certification processes that automatically certify kids for free meals based on means tested programs. We also want to expand access to summer and after school meal programs by adding flexibilities and eliminating permanently those area eligibility restrictions. We want to see a nationwide permanent summer EBT program jumping off of the success of pandemic EBT. And we want to extend WIC benefits to a child's 6th birthday to close the gap between receiving WIC benefits and being able to receive school meals. That's just a tiny snapshot. So at the bottom of this slide, I've linked our full policy priority agendas. As you can imagine, we have wish lists that are pages and pages long, both at the state and federal level. Speaking of the state level, there are some steps that New York can take. And again, just to give you a snapshot of some overarching priorities that we have, we would love to see one door for the means tested programs like SNAP, WIC, TANF, Medicaid, and school meals, so individuals can easily connect with the resources that are available to them. That also necessitates increased funding so that we can reach families with outreach materials, with the assistance that they need to connect. We'd also like to see New York state agencies streamline the process for schools and nonprofits to participate in all of the child nutrition programs that they can use to feed kids, from school meals to summer meals, after school, and childcare meals. And of course, as Sherry mentioned, we're really hopeful that New York will make the Nourish New York program permanent. So again, please feel free to visit our complete policy priorities if you'd like to learn more. And last, but absolutely not least, there are key ways that local advocates and partners can expand the reach of the federal nutrition programs. First, please encourage schools and community-based organizations in your area to make full use of the child nutrition programs that are available to them. That means exploring opportunities to serve free meals to all kids, even before we hopefully make that the national standard. High poverty schools already have the ability to participate in the community eligibility provision and offer free school meals to all. Schools can also adapt their service models to make meals more accessible for kids and close the gap in school breakfast by serving breakfast after the bell. And as I've mentioned, we need to expand access to summer and after school meal sites and childcare meals as well in underserved areas. We can help schools and childcare providers and community organizations with all of these programs. They don't need to navigate the landscape alone. So please feel free to connect with us and to share our information if we can provide a helping hand with any of these. And finally, we really hope that you'll join us in outreach to families, make sure that they have the information that they need to connect with the nutrition programs that are available to them. It's hard to overstate the importance of families hearing about these programs from trusted messengers like schools and nonprofit organizations, faith-based communities in their area. I've linked for each of the programs here our outreach materials that you can absolutely feel free to use. And that's where I will wrap up for now, but we're happy to talk further both during today's discussion and after. We hope that you'll see us as a continued resource in your work. Thank you so much.
Thank you, Sherry and Krista. You've already been submitting questions. Thank you. I'm gonna get to them. I have one question I want to ask Hunger Solutions before we dive into audience questions. So keeping in mind that there is no one solution, no one policy to solving food insecurity. Also keeping in mind, before COVID, like the root of all of this really is poverty, right? So that wish list you talked about, Krista and Sherry, what is at the top of your wish list that you think could have the biggest impact on reducing food insecurity, which again, it may or may not have been in the wheelhouse of what you were talking about, but I'd love to hear your thoughts on that.
Well, I think that an expansion of SNAP and streamlining of child nutrition programs could potentially have the biggest impact, but it might also take a long time and require a lot of effort to get there. So I think my close second answer to that question is the ability to provide one front door for New York households to be qualified for and enrolled in any nutrition program that they are eligible for. And in fact, even beyond nutrition programs. We know that New York State is working towards this with an integrated eligibility system to come in a couple of years. But at the moment, those are the sorts of solutions that would make a tremendous difference for families and individuals who at the moment have to sort of find, apply, and enroll in programs separate and distinct from each other. So one streamlined application process to connect people with all the programs they're eligible for would be a tremendous asset to addressing the food insecurity crisis. Okay,
thank you. I'm gonna share the questions from our attendees right now. There are a lot of questions around the methodology of the survey, which I'm gonna kind of focus a little bit less on, and I know Sophie's available after this. We're available for questions around that, but I want to focus on some of the higher level questions around policy. So somebody was asking if there are any potential opportunities to support the food program levers with, do they align at all with the state Medicaid levers, given the overlap with some of these vulnerable populations who are eligible for both programs? And are these agencies and programs talking to each other at all? Or?
So, I think that there are connections between the nutrition programs in New York State and the Medicaid program. There are connections, but they're not to the point of one enrollment, one pre-qualification, and that's really the goal that we want to get to. Right now, if somebody is applying for and enrolling in Medicaid, that's one process, and being able to apply for and enroll in SNAP is a completely separate application and enrollment process. There are ways that eligible families can get information about the other program from one program, but it really is incumbent upon the household to pursue that information on their own. And so that really, I think, is a place where the process can be tightened to make that easier for families. But I do think that there is some progress that has been made and definitely more that can be made. I think it's a good question because Medicaid and SNAP is probably where we see the strongest overlap between eligible populations. And in a lot of cases, other states have looked at that gap and have found data matching to address it. And that is where New York really will want to go.
Okay. Thank you. Another question is there a possibility of expanding FMNP to have funds exchanged through the Nourish New York program?
Very good idea. I cannot say for sure, but I think that's an excellent idea, and I think we should definitely flag that.
Okay, great. Someone else is asking, okay, do you know of anyone advocating to enact broad and automatic produce incentive match in New York, like the HIP program in Massachusetts?
Right now in New York State, there are
okay, and maybe we can talk about what that program is in Massachusetts. And
Right. I'm less familiar with the Massachusetts program, but more familiar with the New York incentive programs, which provide SNAP participants some type of dollar, either match or contribution to increase their purchase power for fresh produce. There are multiple incentive programs that exist in New York State. Some are funded by the state government, some are through New York City, others are privately funded. So depending on where you live, you may have different access to different SNAP incentive programs. There are also programs for different populations. So seniors, for example, have access to additional benefits through SNAP and farmers market coupons. So those are available to people that when they choose to opt into those. I think there is definitely an opportunity to streamline these incentive programs across the state and increase the purchasing power of them to make them consistent with one another. And I think Massachusetts probably has what would be a good model to look at.
Okay. Nourish New York is great. We all know that. Increased HIPNAP, though, would be better. Any thoughts on how to make that happen?
Advocacy. I think the New York State Food Bank Association would 100% agree that HIPNAP funds are probably the most effective source of funding for that network. Nourish New York is where, I think there was sort of the agricultural component brought in, but HIPNAP has been level funded for many years. And I know that there is a strong advocacy campaign to try to get that increased through the state budget negotiations that are happening as we speak.
Okay, thank you. So someone is asking where in all of this, and maybe it's a sub bullet on the wish list that you guys talk about, but focusing on culturally appropriate food. So, some of the Nourish New York food might have had meat, or it wasn't halal, or it wasn't culturally appropriate for every community that it went to. So is there anything, is that something that you guys have opinions on, or is there a way to, again, advocate for more culturally appropriate food where it's wanted?
I'm going to ask Krista if she has more specifics on that.
Sure. So I'll just say, this question immediately made me think of the strengths of the federal nutrition programs, in that with a program like Pandemic EBT or SNAP, families can buy the food that is best for them and for their families. It has that flexibility for them. And also with the child nutrition programs, there are meal patterns that a school or a nonprofit that's operating the program need to comply with. They need to provide certain food components in certain amounts, but there's a lot of flexibility in the specifics of what those meals can include. And so we see that a lot of the time, the school meal programs and the nonprofits that are operating those programs can adapt their meals to the needs of their communities. So I see this as one of many reasons why we should be maximizing the federal nutrition programs. They have that additional flexibility. I'm not sure that I have any commentary on, ensuring that there's culturally appropriate food in Nourish New York. That's sort of outside of my wheelhouse, but I'm always happy to work with folks on adapting the federal nutrition programs to meet the needs of their community.
Okay, thank you. I think we have time for one more question. Someone's asking, is there a place to find out what the incentive programs are in each area? I don't know if this is by county or region or zip code. I don't know of anything, but Sherry and Krista.
Many of these programs are managed by Agriculture and Markets, New York State Department of Ag and Markets. I know that they do have a summary of each program and how they can be accessed. I will find that and have that included as a resource for everyone. I know that the Health Foundation several years ago did a report on this exact issue, but I think we've seen more and different incentive programs come to light since the publication of that report. So we will find the most current information from Ag and Markets and share that.
Thank you. Yes, we did put out, it was now, I think it's the end of 2019, an assessment of nutrition incentive programs in New York State. This is changing rapidly, and you're right, Sherry, there's so many more nutrition incentive programs now. There's been a spread of certain ones and retraction of others, so it's constantly changing. So I would encourage everyone to take a look at it, but it is a bit out of date. With that, I want to thank you, Sherry, Krista, and Sophie, for participating. I want to thank the audience for all of your thoughtful questions. Again, yes, we are going to share all of the slides from NYSHealth and from Hunger Solutions after the event, and a recap will be sent out there as well. So with that, I hope everyone enjoys the rest of your day. And on behalf of New York State Health Foundation, thank you.